Hi everybody, Dr. Suneel Dhand. Welcome to another video. 3 things that you should remember if you ever have a relative of yours hospitalized. In fact, it may just save their health. In fact, just the other day I heard that there was a patient somewhere who had their entire left side removed. Yes, their entire left side. They were, however, all right. They were all right. Do you get the joke? Terrible. I've sunk to a new low. The simplest jokes are often the best. But seriously, hospitals, despite the best efforts of their staff, their professional staff, who strive every day to do their best to get patients better, are in reality places where things often get missed. They're very busy places, things slip through the net, and I want to advise anyone out there on these 3 particular things. Now, I've worked up and down the country. I've worked in different countries, in different settings, from large academic medical centers to rural community outposts, and I've seen the same things get missed all the time. And in healthcare, we often miss the low-hanging fruit. We're not good at the simple things. We're frequently focused on the more complicated things, but actually it's the little things, the low-hanging fruit, the cheap and often free things, which can make the biggest difference. So on that note, let me tell you these 3 pieces of advice. Now, they would apply to any patient, but particularly I would say an elderly relative. Number 1, medication list. Make sure that your relative is on the right medications. Now, this is what happens. This is what we call medication reconciliation. A patient will come into the hospital, and when they are first admitted, the doctor or another professional will go over the medication list. And there are many reasons why we don't get this right. We have the incorrect medication list. Now, there may be reasons why we don't want patients to continue on their regular medications, but we may have got the original medication list wrong in the first place. And of course, this is a big safety issue. It might be because the patient themselves, they don't remember their correct medications. It might get very confusing. It might be because, and this applies especially in the computer era, we have the wrong medication list on the computer and we've simply copied it forward from a previous admission, and it's completely wrong. But whatever the reasons are, I would advise any relative out there to double and triple check either on the day of admission or the next day with the staff. Usually you'd go to the nurse first, but you could talk to the doctor. Make sure that we know what their correct medications are. We have to be better at medication reconciliation. Number 2, activity levels, and making sure that your relative, when the time is right, is moving as part of their recovery. Now, I have a term for this: sinking in bed syndrome. That's what I call it. A patient will come into the hospital and they're recovering from their actual illness, but they will get more and more deconditioned and weaker because we don't get them up out of bed and moving. And therefore, they have a delay in returning to their previous level of function, or they may not even return to their previous level of function if we don't do this, especially again in elderly people. In fact, frequently it's heartbreaking. I will see relatives come in and they'll almost be begging hospital staff to get their relative up out of bed and moving. It shouldn't take that. That should be something which is automatic for us in the hospital. It's part of the rehabilitation and training process. So many reasons why we're not good at it. Firstly, I would say it's investment by hospitals. We should be investing in physical therapists and mobility aids, but we don't do that enough. Often the nurse is simply too busy to get the patient up and moving. It's not really part of their job. They've got a lot of other things to be focusing on. But whoever does it, we have to be getting better at that for all our patients. We cannot let them get sinking in bed syndrome. So if you are a relative, if you even have to get on the backs of staff to make sure this happens, then please do so. It is simply too important to miss. Your relative cannot get weaker because of the hospital letting them sink in bed and not get up and moving. Number 3, diet. Now, this is my area of interest, and I could talk for hours on this particular topic, but as it pertains to hospitals, over the years, I have frequently been shocked when I walk into patient rooms and I see them on a completely inappropriate diet. They could be a cardiac patient or a diabetic, and I walk in and their plate is loaded with carbohydrates, sugars, and processed foods. In fact, I think future generations are going to laugh at how bad we were in hospitals. I mean, food is medicine. We are what we eat. And if patients during their recovery aren't getting the correct food, how is that going to help with their recovery? It is only going to impair it. So the first thing I would say to anyone out there, if you have a relative with any dietary restriction, if they are diabetic or they're a cardiac patient, make sure that that is communicated to the hospital staff. Following on from that, if there are any restrictions with swallowing, lots of patients, elderly patients, will have difficulty with swallowing and they need a special, what we call dysphagia diet. It needs to be minced up or pureed. Make sure that that is communicated to staff. And following on from this is going in a slight tangent. Often what happens is patients will be made NPO, or it's also called nil by mouth, and we won't feed them because we think there might be a procedure planned for the next day, or there may be some other reason why they can't eat, and patients will go hours and hours without eating when they can eat. That's another thing that I see quite frequently. So make sure that your relative is okay to be fed. If the hospital staff are saying that they can't eat, there may not be a good reason for that, and obviously one has to eat for their recovery. But the main thing that I would say is make sure that your relative on the day of admission or the day after admission when they're in the hospital is getting the correct diet. So those three things then that I would urge you to remember for any relative of yours in the hospital. Number one, make sure that their medication list is correct. Number two, make sure that they are moving around appropriately as they are recovering so they can return to their previous level of function. And number three, that they are on the correct diet. It may just save their health. Again, hospitals can be great places. We do miracles every day, especially in the acute care setting, and we're really good at reversing emergencies. But when patients are hospitalized for a prolonged time, sometimes we can miss these crucial things. Let me know your thoughts down below. Thank you very much for listening. Dr. Suneel Dhand. Do hit the subscribe button down below for more similar videos. You can also follow me on my uncensored platform where we have more open, honest discussions in a less constrained, less censored environment. That link is down below, as is the link to my newsletter. We will speak again very soon.